We found that the number of people aged between 80 and 85 is going to double by 2041. So at the moment there are around 50,000 people in that age bracket, and by 2041 there'll be 120,000. So the demand for aged care is going to significantly increase. At Southern Cross Care, we wanted to inform where we were going to put our very limited resources and energy in terms of developing future capacity and beds for aged care. So we decided to look at where the need was going to be. So where are people going to need aged care in the future? And we engaged John Staff Advisory, who were a service planning expert, to look at planning and data to tell us where we're going to need to build aged care right through to 2041. Well, it was a really interesting methodology because we had to design our planning methodology from the ground up. So we looked at a really wide range of data. We looked at demographics, looking at what populations where will need aged care into the future. We also looked at why people use aged care, so their functional capacity and their age, which are the main reasons why people utilise aged care. And we combined that with the demographic analysis to give us really detailed information about where the populations that need aged care are going to grow in the next 10 and 20 years, and where they're also going to shrink. And then we map that onto the current spread and demand and presence of beds in the state. So we looked at where do we currently have beds, and is that enough to meet the future demand? Are there going to be too many in certain locations to meet future demand, and are there not enough? And where there's not enough, that's where we'll look at building the capacity, and so building more beds. And then we found there were certain areas, certain planning areas and councils in Perth that were undersupplied. So Stirling and Wanneroo and Swan and Joondalup are areas where there's a really significant undersupply of beds, but the population of people over age 80 is projected to grow quite significantly. So that's where we need to focus our efforts in terms of putting new beds on the ground and building new aged care facilities. It's really interesting that the suburbs that are close to the river and inner city suburbs like Claremont and Subiaco, the numbers showed that the population is going to get younger in those suburbs over the next 20 years. So we'll see growth in population, but people are going to be younger and the number of people 80 and above will reduce. And actually, the supply of beds for aged care in those suburbs is sufficient even in 20 years' time. Southern Cross Care is already adopting the research findings. We're developing in Crumbine and we're building houses there, and we're looking at developing an aged care facility there as well. And as we plan to grow and develop and build new aged care facilities, we'll look to develop in the areas where there's greatest need. Southern Cross Care has a history of going where the need is greatest to provide services to local communities. And that's what we're doing in responding to this service planning research. 80% of Australians want to age in their homes. So it's really important that we build facilities for aged care that are in local communities, where people can access the supports that they need, the home care that they need, the aged care that they need in their local community, and they stay connected to their community.